Sandra Valenciano, and all the people here at King County Public Health for all the work they do every single day to protect the health of our residents. And most of all, I want to thank three people who are here to share personal stories: Bronte Lemke, Jennifer Bearskin Sea Monster, and Christina Cummins, for being willing to share how this is not just about numbers on a page, this is about real people. On Wednesday, October 1st at 12:01 a.m., Republicans chose to shut down the government instead of ensuring that Americans across our country continue to have health care. Republicans control the House, they control the Senate, and they control the White House. And when you control all three chambers, it is incumbent upon you to actually govern. But instead, what we have seen is Republicans refuse to negotiate. They sent all of their members of the House home several days before the shutdown happened, and they have refused to ensure that we restore the funding that they just slashed in their big bad betrayal bill and stop the expiration of the Affordable Care Act subsidies that are just on the horizon. Without these two actions, Americans will die. The big bad betrayal bill, passed in July, kicks 15 million Americans off of health care with the biggest $1 trillion cut to Medicaid in the history of that program. And combined with the additional cuts to the Affordable Care Act, those cuts mean that in our home state of Washington, more than 328,000 people could lose their health insurance, and 14 rural hospitals in our state are at risk of closure. Now, there's another crisis looming. Right now, insurance companies are getting ready to set their rates for the coming years, and without the extension of the ACA tax credits, 22 million additional Americans will see their premiums more than double, and healthcare will become totally unaffordable. In Washington state, the estimate is that 288,000 Washingtonians will see their premiums rise. If you are a family of four earning $125,000, the national estimate is that your healthcare costs would rise by $7,700. If you are a 60-year-old couple making $80,000, your healthcare costs would increase by a massive $17,500. And you have to ask yourself, out of all of this, why are Republicans slashing health care for Americans? Just today, right before I walked in, I saw a report from the Kaiser Family Foundation that 3 in 4 Americans on the Affordable Care Act marketplace actually live in Republican states. So this is an issue that affects every single person, regardless of political party. And so my Republican colleagues want you to forget that the whole reason they slashed health care to start with is so that they could give $7 trillion of tax breaks to the wealthiest billionaires and biggest corporations. This is a disaster for the American people. And House Democrats are united in saying that we are not going to let them get away with it. That's why we're holding the line to demand that we restore the Medicaid cuts, that we extend the ACA subsidies, and that we save health care for the American people. Donald Trump promised on day one that he was going to reduce costs. Remember that during the campaign the whole year? Day one, I'm going to reduce costs. He disavowed any knowledge of the massively unpopular Project 2025 agenda that slashes budgets for critical services that Americans rely on and implements an authoritarian overreach of presidential powers. And today, he's proudly owning Project 2025, and he's put his slasher-in-chief, Russ Vought, an architect of Project 2025, in charge of the federal budget. We are in a crisis situation. And instead of trying to govern, the Republicans are all over the country doing massive fundraisers. But the reality is that Republicans need Democratic votes. And I just want to remind everybody that the Democratic caucus in the House was united back in the spring when there was a continuing resolution on the table. It was not a clean continuing resolution, which means that you just continue the funding levels that were there before. It actually slashed funding levels for numerous agencies, including veterans. And that's why the Democratic caucus in the House voted against it. Now, I think they got enough Senate Democrats to vote for it that time around, despite Senator Murray's leadership and pushing against that vote. But what did they immediately do? They then passed a partisan basis that took back money that they just authorized. And so we know that we have to stand up this time and ensure that we stand up for Americans' healthcare. Trump's approval rating trail bill has never been more unpopular, and it's because people are tired of being lied to, they're tired of having promises made and promises broken. They're tired of having their healthcare stripped and watching their nursing homes and hospitals shut down. These are not just numbers on a page, there are real people who are affected, and today we'll hear from 3 of them. President Trump, come to the table and negotiate a deal that keeps the government open and saves healthcare for the American people. Republicans, do your job. Stop the chaos and let's get to work on negotiating a deal that can get the Democratic votes that we need to get this done. Now, we're fortunate in our region to have incredible leaders who are standing up for our residents, for our constituents here, and working hard to find solutions right here at home. And so let me turn it over to those leaders. King County Executive Shannon Braddock, who has been doing a terrific job in leading us here in the county. Thank you so much.
Good morning. First, I want to thank the Congresswoman for gathering us here today, and most importantly, for the work that she does and the rest of our King County delegation does in Washington, D.C. to try to protect the residents of King County. This government shutdown will have serious consequences nationwide and serious consequences here in King County. And as the Congresswoman pointed out, make no mistake, there is one party that is in control of Congress and one party that has the power to end this shutdown. Without compromise from the congressional Republicans, we know that people will lose their health insurance. For one, without the Affordable Care Act subsidies, 67,000 King County residents will no longer be able to afford health insurance. And as a result of the Medicaid restrictions passed by this Republican Congress, if changes aren't made, 215,000 people in King County are at risk of losing their Medicaid coverage. The law harms people because of the loss of that coverage, but it is also dangerous for our local healthcare systems. Public health and community clinics, much like the one we are in right now, will face higher demand. As patients lose their private medical providers, county-run clinics and nonprofit community health centers will increasingly become the only way we can go to access primary and preventative care. Our local health centers do not have the funding for these new patients. Clinics are already at capacity, and with fewer patients insured, clinics will see more and more unpaid and expensive visits. This will add strain to our already limited budgets, and it will ultimately increase costs for local families. We know that the federal impacts do not stop with healthcare impacts. They are also impacting food on the table of our King County families. In King County alone, over 25,000 families rely on the federal women, infants, and children's benefits to feed their families. These WIC benefits are slated to run out in 1 to 2 weeks if the government shutdown continues. And loss of that federal funding means that starting Monday, our state Department of Health has announced temporary furloughs and layoffs of 50 employees who support those services to get those benefits out to our residents. If congressional Republicans don't get to the table and make a compromise and get our federal government open in just a few weeks, working families here in King County will lose healthcare access and the ability to feed their babies. It is heartbreaking. It's bad for the economy, bad for the health and well-being of residents of our county. So I especially want to thank and introduce Bronte Lemke to be here to share some of the personal impacts of these pets.
Hello, my name is Bronte Lemke. I live in Tacoma. I'm a mom of a 6-year-old, a terrific 6-year-old boy, and a few bonus children, and I'm a proud member of Moms Rising here today. I want to thank Representative Jayapal for a chance to tell my story here today and all these other wonderful women behind me. The government shutdown is terrifying for families like mine. We're worried that this will mean we can't access health care, afford our groceries, and keep our families afloat. Already facing so much uncertainty with the costs already being so high. We're horrified that some lawmakers would rather shut down the government rather than fund healthcare programs that help families like mine. I am a Medicaid success story. For the first half of my early 20s, I was addicted to drugs and was having a hard time finding a way out. I got clean when my son was born, and this is only because of Medicaid. Now, I'm so proud to have completed my associate degree at community college, and I'm currently going to UW-Tacoma for my bachelor's degree. Thank you. Medicaid and Apple Healthcare here in Washington State changed my whole life. It covered the medication-assisted treatment services that I needed and made it possible to get me off drugs and changed my life story to the one I have today. Medicaid also covered my son's birth and a surgery that he needed as an infant. It makes it possible for us to get preventative and routine care. This includes the requirements for the immunization status that I need to enter UW-Tacoma as a student. Medicaid covered these costs for me and has kept my family healthy and out of debt. In the past, I've relied solely on food stamps, and I supplemented this with food banks. Food prices are skyrocketing, and I cannot believe the cost of even chicken today. In my home, my son really likes nutritious fruits and vegetables, and I like giving them to him, and SNAP makes this possible. But if this shutdown continues, that money could run out. I am terrified about the drastic cuts to Medicaid and SNAP in Trump's big ugly budget bill, which Congress passed. I don't know what we'll do. I don't understand why any lawmakers think that more tax cuts for billionaires are more important than food and health care for families. I have already seen the impact of looming cuts. It is incredibly hard to get medical appointments and treatment right now, as everybody is trying to prepare ahead of the cuts. The shutdown has made that uncertainty even worse. Each day it drags on, it causes more harm and more families like mine. Moms need Congress to change course, reopen the government, and fund health care now. That is lawmakers' most basic responsibility, to boost families and fund the policies we need to work, to study, and to thrive. Thank you. Oh, and next up is Jennifer Bearskin Cecil.
Miats, Jennifer Sista, Stahotstad, Managachad, Seat Badak Swaklan, Dahadush. My name is Jennifer Bearskin Sea Monster. I am Snohomish, and I am calling in, and I am the youngest daughter of the Sea Monster Man. And I am an Indigenous woman who has lived here in Washington State my entire life. I have lived in poverty my entire life, which means I have been able to access programs such as Medicare and Medicaid. Within the last 10 years, I was diagnosed with rheumatoid arthritis, an autoimmune disease. It's a very painful disease. Without treatment, this disease shortens my life expectancy. It destroys my joints, my eyes, my lungs, all of the things that you need to have in order to live a decent life. It's just been within the last 5 years that my disease has been in remission with consistent access to health care and with the access to this drug called Orencia. It's an infusion that I go into the doctor's office every 28 days, and and I just actually had my treatment yesterday, so I have some ability to feel good today. This drug without insurance costs anywhere from $5 to $8 a month. Now, somebody who is in poverty, I would never be able to afford such a medication. And without this medication, I wouldn't be able to pursue my ability to reattempt to go back to work, to be able to work on going to law school and be able to become self-sufficient so that I can give back to my community, that I can put back into the economy, and ultimately be able to support my son and build generational wealth for my family. So as we're going through, we're thinking about the people who are most impacted by these cuts. It's everybody's responsibility on all sides, on all parts of the eagle, whether you're on the left or the right or the center or the back or the front, you're responsible for the health and the wellness of this nation. You are responsible for the 7 generations going forward. And to not think about the people today and those going forward means you're ultimately deciding that we don't deserve to thrive, we don't deserve to have a good life, and every person in the United States deserves to have a healthy and thriving life. And so I appreciate you all for coming out here. I appreciate for those who have been standing up and fighting for our people and for those who deserve to be healthy. Thank you. And with that, I'd like to turn it over to Christine.
Good morning, everybody. Thank you for being here. Access to basic health care has been a lifeline for my family. As a parent of children with special needs, the journey is often filled with challenges, some days feeling overwhelming, even defeating. But having healthcare has made all the difference. When my daughter suffered an asthma attack, it was basic healthcare that ensured she had an inhaler, a nebulizer, and albuterol, tools that helped her breathe when every breath was a struggle. When we faced the unimaginable loss of her sister, it was healthcare that connected my children to therapists who gently guided them through grief and helping them build coping skills and emotional resilience. My son was born 3 months early and spent precious time in the PICU and in the NICU. He needed occupational therapy to be able to learn the things that many of us take for granted: crawling, walking, talking, grasping toys, utensils, his bottle. Healthcare made that possible. For my daughter on the autism spectrum battling incontinence at age 10, basic healthcare helped us access pull-ups and support with dignity. It allowed her to thrive without shame. And for me, basic healthcare meant I no longer needed iron infusions 3 times a week. I no longer have to pull over while driving because of the unbearable pain that I'm feeling. I no longer have to carry extra clothes in my car or stash them at a friend's home just in case. After 10 years of advocacy, consultations, treatments, I was finally able to have a hysterectomy a couple weeks ago. Something I needed in my life because of healthcare. Healthcare also gave me answers. I learned that I have NASH, which is non-alcoholic cirrhosis of the liver. It's hereditary for me. My mother had it and passed away. That knowledge has been able to empower me to take the steps to protect my health and extend my life further. Healthcare is not a luxury, it's a lifeline. From birth to old age, every person deserves access to care. No one should have to choose between survival and affordability. Healthcare touches every part of our lives, from emergency medicine to mental health, from therapy to surgery to diagnosis and healing. With healthcare, you can sleep at night without the fear of another bill piling up. You can rest knowing your children, your family, and your community can thrive. Let's all stand together and affirm what we should be a universal truth. Basic healthcare is a human right. And now I'd like to introduce Dr. Valenciano.
Thank you, Christina. These federal government actions are about to have very real health consequences, and I'm worried. When people don't have health insurance, they skip preventative care. This means skipping blood pressure checks, cancer screenings, routine vaccinations, and dental care. As a result, we will see more people waiting to go to the doctor until they are very sick. This means community members suffering from preventable causes, increasing spread of disease, and a huge burden and cost to our overall healthcare system. Our public health centers, like this one, exist to provide this vital preventative care to individuals who are uninsured or on Medicaid. This is a core service of public health, but our health centers are already at capacity. We're not prepared to serve the 67,000 King County residents who rely on ACA subsidies to afford their health insurance. Beyond healthcare, I'm so very worried about the real and immediate effects of the government shutdown on families that rely on WIC. WIC puts food on the table for pregnant parents and young children, the time in their lives when proper nutrition is so important to long-term health. But it's more than just food. It's breastfeeding support, it's infant formula, nutrition counseling, and health screenings. If these services are interrupted, even for just a few days, it will mean that children and pregnant parents are going hungry and that babies can't get the formula. You don't need to be a doctor to understand that this is bad for health. I know this information that I'm sharing with you as a doctor and a public health leader, but I also know this from personal experience. I grew up with limited access to care, the daughter of a single mother that received WIC. We got most of our preventative care from our local health department. There was no way my mom could have afforded out-of-pocket medical expenses, and I know we would have gone hungry without government assistance. Programs like Medicaid and WIC are a big part of the reason that I stand before you today as your health officer. Before I wrap up, I want to speak directly to those of you who do have Apple Health Medicaid. I know we're in a scary and very confusing time right now, and many of you are so worried about losing your health insurance. I want to reassure you that your Medicaid still works, and the changes to Medicaid on the horizon aren't going to take effect for at least a year. We really encourage you to continue to seek care when you need it. And for anyone who needs assistance navigating the health insurance system, we at Public Health are here to help. Please call our Community Health Access Program for free help at 1-800-756-5437. I'd now like to hand it back to Congresswoman Jayapal.
Thank you so much, Dr. Louisiana. Thank you to all of our speakers today, and I'm happy to take some questions for any of us.
Aaron Allen with the City Media Newspaper. As much as an uphill climb it may seem in Congress, does the Democrats have any leverage to move the needle a little bit? And can you give us maybe an example of what type of leverage that the Democrats may have in Washington?
Yeah, look, the only leverage we have is our votes. And all of us have united in the House Democratic Caucus to vote against this bill until we actually can save healthcare and make sure that the cuts are reversed, that the Affordable Care Act subsidies are extended. In the Senate, if they passed the bill anyway, because in the House it's a simple majority, but in the Senate they need 7 Democrats. And this is what it means to govern. And so the choice before us is a terrible choice, because in an ideal world you would have the majority party recognizing that they need those votes and therefore they have to sit down and negotiate. That's what it means to govern. And so we are determined to use our leverage, because it isn't only that Republicans are slashing healthcare, it's all of the ways in which Republicans have made and broken promises. So it's not like any other situation where you negotiate a deal and then you can count on people to keep their word. We actually need ironclad guarantees on whatever deal we come to, that they won't then just go and slash an agency or slash funding. But I have some hope that we have continued to unite Senate Democrats as well, and that the president will realize that this is incredibly unpopular. Slashing healthcare is very unpopular, and that they're losing the battle when people think that they're shutting down the government rather than providing care to the American people. And so that's our hope right now. We're going to use our leverage as long as we can to get a deal that actually brings back healthcare, ensures healthcare. And for anyone who says this isn't urgent, it is urgent, because those notices are going out right now. And people need to make their decisions about open enrollment right now. And so this is not something that can be kicked down the road some more, but I have some hope that the American people are with us, and that's really ultimately the best hope that we have to make sure that Republicans come back to the table.
So the concern with open enrollment is that people right now will let their insurance lapse because they're worried about the costs. Is that why it's crucial?
Correct, because the rates are being set right now, and we've already seen increasing substantially, and I think everybody knows I'm not a big fan of just continuing to subsidize big private insurance companies. I believe we should have government-funded healthcare, but this is a crisis moment right now where we have to protect Medicaid and restore those cuts that were made, and we have to make sure that these premiums continue so that premiums don't double for Americans across the country. I mean, in many parts of the country, and depending on your situation, people are looking at a doubling of their premiums, and it's absolutely impossible. And there are studies that are already showing how many tens of thousands of people will die if this goes forward. Anybody else? All right. If not, let me again thank King County Executive Shannon Braddock, Dr. V, as well as, most importantly, for sharing your stories and for bringing this home in terms of reality for what Americans are facing across the country. Thank you all so much for being here.